Sometimes we see the problem and we think, okay, well, here's the solution to solve this problem, right? Just like they said, transportation, horse, how do we make this transportation faster? We put the wheels and carriage with a horse, But if this was the way we would be thinking to this day, we would, imagine what would happen with our streets if we were still riding horses with carriages. So it's really stepping back and saying, well, yes, let's look at the problem from a different angle. What are we trying to solve? What are we trying to improve here? And think of creative ways and different mindset about how you can go about it. So don't get stuck in one way of, solution problem, right? There's tons and tons of different innovations. As you know, there's product innovations, new products that are coming out or improvements to existing lines of products. Like, you see different models of cars, for Toyota and all the other brands, and they keep improving and innovating with new features for a new release, right? Process innovation, again, I do a lot of work in healthcare, hospitals and clinics and so on. And there's tons and tons of continuous process innovation. How do we make it faster? How do we get the test results quicker? A lot of these things are around process innovation. Service innovation, again, it's about how do we deliver the service differently. I worked in a pharmaceutical company, and we had a product that wasn't selling well. And as I started doing my research, going out to our customers, going out to clinics and hospitals, talking to patients, I realized the reason it wasn't selling well is, one, it was very unaffordable and expensive for patients because they had to pay out of pocket. And two, they were very sick patients, cystic fibrosis patients, and they had to, going for another medication pickup was a little bit too much for a lot of these patients. So they sometimes would just avoid and not even take that particular medication. So we had to go about how do we deliver that particular product differently. And the solution that at the time, that I worked on with a team was we created an online pharmacy contract and partnership, and we not only reduced the cost of medication for patients, but we made it extremely convenient for them to go online with a prescription they had, order their medication, and it would come right to their home. It doesn't have to be a major innovation where it takes 14 years to develop a new drug and bring to the market. It could be smaller, much more incremental things, such as instead of making a patient take 3 doses of this medication a day, we were able to formulate it into 1 a day. So you've created a lot more convenience for your patient. Or we've discovered that this particular medication is good not only for what we thought it was good for, but it also cures another type of condition that patients have. So those are incremental ways of innovating. I mean, you can think in your own world what those could be. Again, the incremental ways of, these companies slowly but surely changing the way their products are. See how EMR, which is now used majority of hospitals and clinics, has changed the way, physicians interact with patients. They now have access to, before you even get to see the patient, they can access your records, they can see the history of your disease and any other tests that you've had over the last year, for instance, right? So now EMR has become something that physicians use and create patient portals where they can interact with the patients through this patient portal and answer questions, or they can have patients book and reserve their own appointments to see physicians. So it's a major breakthrough which is developing further and further about how the medicine and how healthcare will be delivered. It's interesting because I work a lot with innovation community and innovation hubs all across Toronto region. And there's a program the government put in place which they give a startup grant, entrepreneur grant, and they give it to anybody who's under 29 to start up their own business. And it's amazing. Some of these people are so smart and so out of the box. But at the end of the day, I think, I'm not sure if they picked the right age category for the startup money, because some of us, have the realistic side of experience that just because this sounds like amazing doesn't mean it's really feasible or practical to implement, right? So sometimes I'm like, how do we convince the government that, it should be 29 to 49 range, right? So. Right. So, you start guiding them and coaching them, but you see that optimism that they have, which you don't want to take away from them, but at the same time, you've been there, you've done that many times, and, you start getting that skill set, which is difficult to transfer until you experience it, right? So it comes with the experience.